Dr. Benji. I'm here with the amazing Dr. Ash, aka the Chiro guy.
That's right.
He's LA's top chiropractor, close friend of mine. And today we're going to be talking about sciatica. So, Doc, why don't you talk about what sciatica is, the general population who has it, and what types of injuries typically cause sciatica?
So sciatica, there's a nerve that goes from the low back, wraps around the hip, and it gets impinged either from a disc herniation or tight muscles. In my findings, most of the issues come from tight muscles, primarily piriformis, which is a muscle that the sciatic nerves goes right under. People come in all the time. They tell me they have sciatica. Oh my God, I have a disc bulge, blah, blah, blah. And luckily for them, most of the time I discovered that it's more of the muscular issue. So we work on the muscles. We hit on the disc bulge as well, but we really concentrate on the muscle tightness. So we rehab that. We break up the scar tissue. We give them stretches, and we also incorporate with the nervous cyst because it really relaxes and takes the inflammation away. And that's generally how we solve sciatica.
And the majority of the time, it's a muscle issue, not so much
the muscle issue, believe it or not. Because with disc bulges, there's really not much you can do with a disc bulge. It doesn't go away. So what we do is try to fix your posture, take care of all the muscles in the area, and we got to fix the muscles. So by doing that, the pressure that's causing the nerve to be irritated gets relieved. So that's how you get better without necessarily having to do surgery, because you definitely don't want to do the surgery.
Is it mostly like men, women, older, younger athletes, or kind of a mix of everything?
It's a mixed bag now, especially with people sitting and now being sitting at home and stuff like that. That muscle gets tight. Some people, it's old injuries like repetitive use, like commercial truck drivers, anything that's a repetitive bouncing motion or sitting motion, something that would cause a compression. These things make the muscles tight or irritate the disc for it to bulge out, and it irritates the nerve.
What do you have in the office that you like to use as far as like advanced, I don't know, if you have ultrasound or if there's some sort of cryo freeze?
So you know me, I'm a gadget guy. So I spend at least 45 minutes per treatment. Just releasing the muscles. So we do anything from electric stim, which is EMS, stimulate the muscles, relax them. We do ultrasound to break up the scar tissue, get rid of the inflammation. We use traction, compression, Normatec, we compress it and flush out the swelling. And we also have cryotherapy that helps a lot of times too.
And how do you incorporate nervous cyst, the freeze gel these days? Something you do at the very end, or?
We give them stretches to do to loosen up the muscles, and we give the nervous cyst because sometimes with the stretching is not enough. They need something a little extra to give them a little bit more pain relief until they can see me again. So it's a good thing to remind them to do their stretches, but when you're in pain, the stretches aren't enough. You can put the nervous cyst on. It gives them pretty much instant relief. It relaxes them, brings down the swelling, so they have that relief until they see me on their next visit.
Do you think posture plays a role? And if so, like having bad posture would be people who are forward facing, or is it the ones that are, I'm assuming that's the majority of the time, those that lean forward, they put excess pressure? Or
the more pressure you put sitting, it definitely causes it. And it's basically when you're sitting on your butt, all these muscles are just kind of tightening up because you're not sitting, you're not moving, just getting tighter and tighter, and all the weight is on you. And when you get up, it's not like, oh, okay, now we're going to relax. Now they're just going to stay tight. And you do this days, months, years in, at some point, you're just going to hit that wall and have this pain. So we definitely work on the posture. I give them stretches while they sit. I recommend everyone to get the custom insoles, because if you're walking and your posture is not correct, your ankle, knees, hips, it goes into your low back. So that's one of the other things I always push too. It's get your insoles. They work wonders.
What do you recommend for people who sit all day? Like, is there some sort of a pad you want us to use in our chairs, or is it just doing the stretches?
The stretches are the best. I have
Okay.
these very affordable balance discs that I have you sit on, and they give you some exercises to move around, give some
Yeah.
like stretching, and the stretch is a key. I generally go over your daily like your setup and see
Uh-huh.
if there's any way I can convert it into like a standing desk, or if I can give you any kind of anything else I can figure out for you in that way.
Yeah, it's crazy. Like a lot of our patients that I see that I refer out, they work from home, and so they're sitting all day. They don't even get up to go to the car. They get up and put something on and go to their office, and they're at work. So the
Yeah.
sedentary lifestyle, I think, is also playing a role. People are starting to gain weight, not going to the gym as often.
Weight is huge, and they haven't been able to have their normal. The ones that were working out, their routine is messed up because
Broken
the
up.
gym is messed up, and whatever else
Yeah.
they were doing is closed.
Yeah.
So, yeah, it's a pandemic on a different level with people like being more staying at home more
Yeah.
and sitting, and then a lot of them like to sit on the couch now versus like a chair. The funny thing is, couch and beds are worse than sitting on a chair because you sink in more,
Oh, right. Right.
or you want to you get comfortable and you kind of do this or whatever it is. It's bad, man. It's
You
just
know,
it's
it's
even
funny.
better.
Every time I talk to you, whenever we're on a call together, I naturally am like focused. I'm like, all right, let me stand straight. Why am I leaning forward? And it happens to all of us, man. Like I have a seated desk, and I'm considering getting a standing desk because the more I sit down and I don't have any support behind me, I
Yeah.
feel it. I feel this tension building in my back as the day goes on.
I would 100% recommend getting a standing desk. But one thing that I want to make sure everyone understands is I don't want you to be standing all day. There is a ratio between standing and sitting. I like 1 hour stand, 10 minutes sit, and those 10 minutes that you sit, you're doing your stretches. If
Okay.
you could follow that simple rule of standing 1 hour, sitting for 10 minutes, do your stretches when you're sitting, you're gonna really see an
Golden.
improvement right away.
Okay.
It's 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 a given.
And lastly, is there a role that you think that cryotherapy plays for sciatic pain, for low back pain?
The cryotherapy I generally use if it's really bad and they're in a lot of pain or I'm having trouble getting rid of the inflammation. It's really
Okay.
good for instant inflammation release. And that again, when we're talking about nerves, it's all a space game. Nerves need like specific space to function and go through. So if there's
Yeah.
something impinging on it, that's where you get the nerve pain.
Got it.
So if you're inflamed, you're gonna have less space. So we want to get rid of inflammation. If your muscles are tight, it's impinging, less space. So I always look at it as a space thing. Stretch out, loosen up, fix your
Yeah.
posture, give it the proper space that it needs to flow freely without being impinged.
Right.
Yeah.
Okay. All right. Well, you heard it here first. Sciatica treatment with the Chiro guy. Thanks so much for joining us, Dr. Ash.
Thank you, buddy.
And we'll do it again soon.
All right, brother. We'll see
Appreciate
you.
it, man.
Take care.
Bye. Bye.
Bye.